If your nervous system is stuck on sick, is stuck on active, it doesn't matter what we give you. So how do you like to retrain the brain? Welcome to today's episode of The Medical Disruptor, the show where we challenge outdated medical norms and redefine what true wellness looks like. I bring you the innovators, the boundary breakers, and the trailblazers who refuse to accept the status quo. These disruptors are revolutionizing the way we approach wellness so you can feel better, live healthier, and take back control of your health. This is part 2 with Dr. McCann. If you didn't hear part 1, go back and watch it. It's just that Dr. McCann took it to a whole other level and it deserved its own spotlight. Yes, we're still talking about MCAS, which we did in part 1, but here we get past the conversation of all the usual triggers, which are important. But here we start talking about something we've never talked about before, which is the spiritual work you need to heal. And to heal MCAS, you need to do the spiritual work as well. I am so grateful for this podcast because I get to meet the coolest people in the world. And Dr. McCann was one of those people. And we just had to keep talking. So it became a 2-part series. Let's enjoy it.
A variety of different things. I mean, I think the important thing is that patients need to feel empowered to choose the things that resonate best with them.
Say more.
So I think, I mean, I have lots of toys, right? So I bring out, 5 or 6 different kinds of vagus nerve devices. I won't take the time to grab them, but if you want to,
Grab,
oh, okay.
grab one. But my listeners would expect nothing more. And if you're listening on audio, come on the YouTube so you could see what she has in her hand.
Right. So this is called the Resi Max. It is a vagus nerve device that was developed by a physical therapist. It vibrates. I don't know if you can hear that vibration at all, but
What do you do with it?
so you can put it anywhere in the body. Really works well for pain, especially. So say you've got some neck pain. There's another device that broadens out the response. You can put it on your belly if you have constipation, urinary retention. You can use it to like scrape along the body with that vibration. There's a whole bunch of different ways that you can use it. Then there's something called the Muse, which is a headband that links to an app on your phone. It works like this. I usually have to take my glasses off. It provides neurobiofeedback. So as you're listening to a soundscape that's playing on your phone, the Muse is reading your brain waves and it translates your brainwaves into the soundscape so that when your mind is calm, if you're listening to a rainstorm, for example, the rain is going to be a gentle pitter patter of rain, and you might even hear some birds chirping. And if your mind is and your thoughts are chaotic, it's going to sound like a thunderstorm.
Ooh.
So, and then one of my favorites is actually called the Apollo Neuro.
Oh, I love that one.
So the Apollo Neuro, mine's in the other room, is a wearable. So it's you can wear it on your wrist, you can wear it on your ankle. It has a little motor in that, and the pattern of vibration stimulates the vagus nerve and puts you into parasympathetic. And parasympathetic, we call, we learn to rest and digest.
Rest, digest, yeah.
But it's so much more than that. When we're in parasympathetic, we can be creative. We can feel joy. We can connect with other people. We can remember things. We can digest our food, right? So there's so many benefits. We can heal. There's so many benefits to being in parasympathetic as opposed to sympathetic. When we're in sympathetic, we can hopefully save our lives, but that's about it.
You're ready to brawl at all times.
What?
So ready to brawl.
Ready to brawl. Yeah, we don't get to digest, we don't get to learn things, all of that. So what I encourage patients to do is like, here's a list. Go explore. Which ones resonate with you? Play with them while you're here in the office. I put the Apollo Neuro on my patients when they're sitting here. And by the end of the time here, it's like, okay, how did that feel? If it felt good to you and you feel better, you might want to pick one up. If you notice anything, then we'll move on to something else. So that's kind of the biggest nerve piece. And then even with the limbic retraining, there are a number of programs out there. Probably there are two older programs that have been around a long time. Annie Hopper's DNRS, which is excellent. Love Annie Hopper. And Ashok Gupta's, the Gupta
Gupta.
program, which is also excellent. He's got a really nice app. Both of them are wonderful programs, and they have helped thousands and thousands of people over the world. I also really like Primal Trust with Kathleen King. That's a more new program. Many of my patients have really liked that a lot because it does incorporate more of the somatic experiencing kinds of exercises. And honestly, patients need to they need to develop their own program, right? Just like you
Yes.
come into a functional provider and you get your personalized list of supplements based on what's going on with you, you have to do the same thing with your other treatment
Yes.
modalities.
There's no one size fits all.
No one size fits all.
So, okay,
Um,
so I love that we're training the brain, the limbic, the vagus nerve as part of the protocol. But now you are taking it a step further. You have recently discovered, tell us.
you know, as I develop a rapport with somebody and they start to feel better, at some point, there is often an opportunity to have a conversation to say, would you consider what if? What I find is that, the people who do traditional Chinese medicine, the chakra system, Louise Hay, all of these metaphors of aspects of the body are really real. And so the conversation starts something like, all right, you're I have a patient who has ulcerative colitis, and she recently had a flare. And, we've been working together a long time and we have a great rapport. And as she's sitting there, I can visualize in my mind's eye that all of the energy that she has in her solar plexus right here is just streaming out of her.
Wow.
her her mom and her sister was having a lot of issues. She had a suicide attempt, and this woman is like the most kind, generous, giving person. And she was just giving to the point where she had nothing left for her, right? That her perception of her role in the family was, I got to keep the peace. I got to make everybody happy. And I got to give everything that I can to keep everybody stable. And quite literally, she was poking holes in her
Wow.
gastrointestinal tract
Wow.
because
Wow.
she was giving it all away. Right. And I talked to her about this. And I think, little light bulbs start going on. She's like, yes, I do that. Yes. Yes, I feel that. Yes. And being able to have those conversations and open up the possibility, you know, it it allows people to take more ownership, right? It's not like I have this disease. I think one of the things that we forget is that our bodies are doing the best that they can to keep us as healthy as possible. Even when people are in the ICU, and they're like flooding the system, or they're having a septic response and their blood pressures drop because they're trying to flood the system to dilute everything and deal with the inflammatory response of a septic situation. It's still doing the best that it can
Yeah.
physiologically to try and
Yeah.
help us, right? And we have this perception in conventional medicine that our bodies are against us,
Yes. The
right?
autoimmune, the body's against us, attacking
But
itself.
right,
Yeah.
but
Yeah.
what if that's not actually true?
Right.
What if, the body is doing everything that it can to protect us, even in autoimmune conditions, right? Because the immune system is perceiving that there's a threat there
Correct.
that
Correct.
needs to be addressed and attacked. It just so happens that it's misperceiving, it's miscommunicating. And so it's the same thing with having these conversations about the possibility of spiritual spiritual aspects of things. Like, what is the meaning? What is our relationship to ourself, our relationship to how we are in the world, and what is our purpose on the planet? So, if my purpose on the planet is to express myself through my voice, and I am not speaking my truth, not honoring
Mm,
that, I've cut myself off, I'm not allowing the connection between my head and my heart to exist, could I possibly get thyroid issues?
sure.
Think about all the women
I was going to
who
say women. Why are
planet.
women more prone to this, right? It's not.
Well, what are we taught to do? We're
Absolutely. This is
take
not a
care,
disease that's X-linked. Why is this happening more to women?
right?
Absolutely.
Um,
I love this. What about joint pain? What's like, so this is really metaphorical and the belly is really metaphorical. What about joint pain?
and I think that this is where each person has to be curious, question, like, what does that signify for me? Certainly, the joints are how we get around, they're how we express ourselves. There's a lot of potential metaphors that we could
That's fair.
use. And which joints? So, are we talking about our legs? Are we talking about our hips? Are we talking about our ankles, our feet, our hands? And then which side of the body, right? So the right side of the body is often the more masculine side, the left side is the more feminine side. But we can say, well, maybe the right leg has to do with our ability to move forward in the world.
Mm,
And in that case, is the left leg our stability, our, you know, I don't know.
right,
So
right. That's
we can
difficult.
use the metaphors that exist already in traditional Chinese medicine and the chakra system. Louise Hay. Yeah. I mean, we have these tools, these different metaphors, but then you have to like go inside and reflect on it. What does this part of the body mean to you? What does the manifestation of your symptoms mean to you? How is it that you're not showing up for yourself? How is it that you are not honoring
Ooh,
or your soul's purpose on this planet?
I'm thinking about it myself as you're asking that question in this very calming tone. I'm like, so am I not honoring my purpose on this planet? I love this question. And so now this is interesting as a provider, right? So you got here. So now when you meet your patients, do you start there or do you still wait and get there after you remove some of the
It
kind of,
depends.
I guess depends, yeah.
It totally
Depends
depends.
also where the client is. If the client's like, I'm already on this, I do the training, I do this, I'm taking 16 supplements, or like where am I? So as opposed to someone who's just starting the journey.
It absolutely depends. It depends on their openness. It depends on their level of suffering. It depends on
Ooh,
so many different things. Yeah, I'm actually writing a book.
what's it called?
And it's I so far I've highlighted and interviewed 7 of my patients and have taken them from most of them very sick to this transformational process. And I remember one in particular, she had mast cell and oxalate issues and just felt awful, mood issues, hormonal issues, like all this stuff. And it probably took us 18 months before I was
Yes.
like, okay, you're ready.
Yeah.
And then we, opened up this conversation. And now she's working with a medical intuitive. She has healed so much of her stuff and used and a lot of what I've learned from my patients, of course,
Of
right?
course.
And one of the things that was really interesting from her was she couldn't do the Gupta program. I mean, she got a little bit out of it, but for the most part she couldn't find joy. She had
Mm,
no experience of joy.
mm.
And that was really eye-opening for me, and also reinforced this idea that we have to start where we're at, and we have to do what is in alignment for ourselves to the best of our ability, right? Eventually, she found joy. Eventually, her whole life is joyful now.
She couldn't find joy, and correct me if I'm wrong, I don't know this person, but just the way you phrased it, but she wasn't depressed. Or was
Um,
she depressed?
she was depressed, like, sick people get depressed because
Right.
she was not on any psychotropic medications. She did not have clinical depression.
Yeah. It's a very particular phrasing because I could see, as I'm thinking through my patient population, people who are not, don't consider themselves depressed, but I don't know that they could find joy. And I don't think until you phrase it that way that I saw such a distinction there. The ability because people are depressed will say to you, I'm really, like, they suffer with the sadness, which
Right.
is one side, but some people are not sad. They're here, they're fine, they're functioning, everything's fine, but they may not be able to find joy. So that's very interesting. I
Yeah.
know that wasn't where you were going, but it just struck me.
No,
So
but I think it's important. And that's where just reinforcing that part of the journey, part of the reason that we experience what we do is that it's because our heart is longing for us to live our purpose, whatever that is. I mean, okay, yes, I believe that there's a universe and I believe that there's spirit and I believe that we have a soul. And I guess you have to kind of start with that. If you don't believe that there's something other than your physical body, this conversation is not
sure.
for you, right? But most people in the world have an experience that I am not my body, but we greatly identify with our bodies.
Yes.
And we should, because our bodies and our souls are linked in this lifetime so that we can learn these lessons.
Yes. I used to be one of those people who thought it was just a body until I had an experience and I was like, oh, I was wrong. And just like that. And just like that, I changed my mind. Oh, it seriously was like, it was a 5-minute experience. And I was like, I was wrong all this time. And that's why when I meet people who still, and I'm like, that's okay. Y- You know, it's
You
okay.
may or may not
You may
get
or
there.
may not
It's
find
okay.
out. You may or may not find out. That's okay. It's so interesting. Okay. Wow. I could talk to you forever. Tell me, is there anything that you want to tell our shared audience that maybe I didn't ask you yet?
I think one of the most important messages is that there's always hope.
Mm,
You know, there's always hope. Complete opposite of gaslighting. There's always hope.
because you're on
Um,
this side of medicine. That's why.
right. And that when you are open to hearing your intuition, the healing will speed up immensely.
Wow. That
When
is
you
so
tap
important.
when you tap into that intuition, it's like the light bulbs goes off, the pathway illuminates in front of you because you know what you may not know exactly what you need to do, right? But you know what yes feels like. I
Mm.
actually teach my patients who are interested in learning how to muscle test
Well, like kinesiology.
kinesiology. Yeah.
Okay.
Yes. I'm a little woo. Here
So
we
you teach
go.
them to like strength testing. So like what they should hold like like something they have to decide on in their hand.
Yeah. Yeah. And so the first thing you have to figure out is what's yes and what's no. So you do that without holding something, right? And you can do, I mean, I have patients who use their fingers and do like the ring test, like yes, no. I have patients, usually I teach them the sway test. So they're standing upright. They might put their hand on their heart or their hand on their belly. And they'll ask, okay, body, show me yes. And if they feel pulled forward, that's yes. And then show me no. And oftentimes they're pulled backwards.
Mm.
And then once you've established what's yes, what's no, then you might, take a supplement and say, okay, is this good for me? And if they pull forward, the answer is yes.
Wow. Is it? Do they have to look at the supplement, or could someone just put it in their hand and they should be able to know? They should work
Um,
regardless.
again, it depends on the person, and
Yeah.
like you have to suspend your disbelief a little
Yeah,
bit.
suspend your
Right?
disbelief.
It's
That's
a
what I'm saying.
game.
Yeah.
It's a
That's exactly.
game the first
You're
time.
the only other person I know who's used that phrase. I love that phrase, suspend your disbelief. That was from my Shakespearean first degree in English literature. Suspend your disbelief.
Well, you have to
You
in order
have
to do
to.
this,
You
right?
have to suspend your disbelief to jump into this world and then just see where it goes. Ah, it's such a good phrase. Suspend your
Yes.
disbelief. So what you want to tell our patients is there's hope. Lean into your intuition. This muscle testing is a great tool once you suspend your disbelief to see if things are
Right.
working for you.
The other thing I will say is when people have mast cell activation and they're stuck in fight, flight, or freeze, it's very difficult to access your intuition,
Mm,
right? And part of the reason I think we get sick is because we've lost our connection with our intuition and we don't trust ourselves.
that's so true. That is so true.
So, if that's the case for any of these listeners, don't give up hope, right? Your soul, spirit, being, intuition is in there. It's communicating to you, and you will get there. It takes some practice, it takes some awareness. Intuition feels like that safe harbor of knowing inside of yourself.
Dr. McCann, do you want to share with us what your purpose in this world is?
I don't know exactly, but I think it's to talk about this.
Oh, I love this.
Yeah. Because, we know that the conventional model is not working and the functional medicine model is fantastic,
Fantastic.
but without the spiritual piece, it is still woefully incomplete because it still looks at the human body as mechanistic, right? We're just substituting supplements for medications. We're not really healing. And in order to really heal, we have to heal at all levels: mental, emotional, spiritual, energetic, and physical.
Oh, I love that. Thank you for being so vulnerable and speaking that truth. And that's how you know it's your truth. There's that litmus test right there. Oh my God.
Yeah, there it is.
Dr. McCann, that was so powerful. I love that. How can people work with you?
I have a brick and mortar practice called the Spring Center in Southern California. I am licensed in, I don't know, 11 or
A
12
lot.
states. So if you happen to live in a state where I am licensed, you can become a patient and work with me. You do have to come to California first for the first appointment, and then we can do telehealth. We do ask that people come back at least once a year. And who wouldn't want to come to California at least once a year?
Absolutely. Thank God you didn't sit up in Idaho. No disrespect to Idaho. I'm just saying, who doesn't want to come to California?
Right. Just about any time of year.
Just exactly right.
And then I do have a personal website, drkellymccann.com. I have a webinar series. I also have blogs, and I'm looking at doing some group programs for people who are not able to come to California or who can't become patients. So stay tuned later in the year, hopefully.
Dr. McCann, I can't thank you enough for my listeners and myself. I was moved. I'm asking myself so many questions. Going to go get my Vegas device that I've put on the side for a long time and bring it out again. Truly, truly impactful. Like I just can't thank you enough for this time. It was amazing. And for anyone listening, struggling, go find Dr. McCann and go to California.
Oh,
Oh, a pleasure and an honor. Thank you so much for your time.
you're welcome. Thank you, E. Thank you so much. This has been great.
It's been amazing. Thank you for listening to this week's episode of The Medical Disruptor. If you like this, I also provide education content on Instagram, TikTok, and Facebook. And of course, I have a book on Amazon called It's Not in Your Head, because it's not. If you're a nurse practitioner looking for more, you could always check us out on egprep.com, where we teach nurse practitioners to gain the clinical confidence that they need. See you next week.